consistency. And then the third consistency that might be prescribed would be a pudding consistency, and you can see that that is the thickest consistency of these three items. And so again, it's extremely important that you follow the instructions that have been provided by the nutrition support team so that the person with the swallowing problem, dysphagia, can make certain that they are not going to have aspiration. When they are being fed, they should be in an upright position. Sometimes they say bolt upright. That means really straight in a 90-degree angle. But it does help them so that they do not have that aspiration problem. Then they remain in an upright position for at least 30 minutes after the meal. Encourage to have them tuck their chin when they're swallowing. Tucking the chin can help swallowing so that it goes into the stomach as opposed to into the lungs. Alternate liquids and solids so that you're not giving all the same thing ongoingly. Encourage them to swallow a second time to be certain that the food that has been placed in their mouth has been swallowed. And encourage them to eat slowly. This is not a time for a lot of conversation. These folks have to work very hard at trying to swallow and keep food from going into the lungs. So limit your conversation and have them eat slowly. Keep the amount small. Only about a half a teaspoonful should ever be presented into their mouth at any given time. Watch for pocketing of food in the mouth, and do not give them any more food if you notice that they have a large amount of food that's still in their mouth, or they should completely empty their mouth before you present them with more food. The orders from the nutrition support team might also say that they may not use any straws. So watch for the instructions because they are individualized for each patient. Now I'd like you to watch a demonstration of feeding a patient with dysphagia. Feeding a patient with dysphagia. Wash your hands. Prepare the patient for mealtime. Position in a bolt upright position with feet flat on the floor. Use pillows if needed to maintain an upright position. Obtain the meal tray and check for completeness. Check the diet card with the patient's identification bracelet. Check any special instructions for feeding this patient with dysphagia. Assist in food preparation. Add thickener to liquids as needed. Do not use straws. Place food on the tongue with a spoon filled half full. Have the patient tuck her chin about 45 degrees. It will help to prevent aspiration. If the patient is paralyzed on one side of the body, feed on the other side of the mouth that's not paralyzed. Encourage to swallow twice after each bite. Watch the Adam's apple rising and falling as an indication of swallowing. Do not rush. Allow the patient to set the pace for eating. Provide verbal cues to remind the patient to open, chew, and swallow. Avoid distractions. The patient must concentrate to swallow. Check that no food has been pocketed in the mouth and is completely empty after feeding is completed. Complete the follow-up tasks after feeding. Keep the patient in an upright position for 30 minutes or as directed after eating. Wash your hands. Now that you've seen that demonstration on feeding a patient with dysphagia, I'd like to talk to you about some assistive devices that are used. These are special feeding utensils that are designed to help patients perform tasks that they ordinarily otherwise would not be able to. These items are usually needed for patients that have had a stroke, for example, where there has been paralysis or weakness on one whole side of the body. Or it might be for someone with rheumatoid arthritis where they have a lot of swelling and stiffness in their joints, particularly of their hands, because that's what we're talking about in this discussion about the need to be able to feed themselves. There are a lot of different types of assistive devices, and I've just brought a sampling of them for you to be able to see. The first one is an easy grip cup. You can see that this would be easier to hold on to than a coffee cup that has a little handle for the person who has maybe weakened muscles or a very stiff hurting joint to be able to hold on to. So that's one item that you might see. Another would be built-up utensils. And you can see that the handles have been built up so that the individual who may not be able to hold on in a pincher fashion to these utensils can grab on in a little bit more coarse way to be able to get food items. And they come on all of the different knife, fork, and spoon for the individual's use. Another item is called a food guard. Sometimes people can only use one hand to feed themselves. The other hand might be paralyzed, and so by placing food on the plate, they are able to scoop the food over up to the edge of the guard and then get it up to their mouths and be able to handle it with just one hand. The other item that I have to show is a food grip, or a plate grip, I should say. This plate grip goes underneath a plate and helps keep the plate stationary. So again, if the person is just using one hand,